Save the NHS!
After 30 years of nurturing and growing a National Health Service, we have a government determined to end it. We have ministers who are in charge of the National Health Service who don't even use the facilities of the National Health Service. And we have a Prime Minister who has a pathological hatred for anything that's publicly owned. And that means owned by you, not a bunch of sharp-dealing shareholders. Now, we've had a lot of statistics in the House of Commons, but I'll give you one statistic that I don't like quoting, and that is that since 1979, this government has underfunded the National Health Service by £2 billion since 1979. That's meant wholesale closures of beds and wards. That's meant hospitals closing. That's meant longer waiting lists. And that's meant cancelled operations. And I was told off before the general election for accusing the government of clinical murder. We now have the proof, the evidence of murder carried out by this government by not properly funding the National Health Service. But the issue we're told is not money. We've had some jokers in the pack. You know a bloke called Kenneth Clark? Well, he's got two jobs.
To erase the obscenity of only those with the ability to pay getting proper treatment without waiting time. Because of the policies of the present government, that poverty still remains and is now more political than ever. But at last, the mist of ignorance is clearing. The campaigns to arouse complacency are being heeded. The lies have been exposed. The whole country is now very aware that the health service is not safe with the Tories.
Yes.
Parents are no longer willing to see their children wait and suffer. The message to the government is quite clear. Pain and suffering on long waiting lists are not acceptable. We have a basic right to health care, free at time of need.
I believe that the principle of freely available treatment for all is of central importance, and this is why I'm here. Unfortunately, the funds available are insufficient, and this has happened for three important reasons. There are increased costs in advances in treatment. We have increased costs for a population which is on average getting older. And thirdly, and most important, we have insufficient funds from central sources to pay the basic costs of the service, let alone the costs of medical advances or an aging population. This financial restriction has been coupled with restriction of funds for research, so that support for improving treatment is not what it should be. The consequences are clearly visible in Birmingham, with restricted services forced by a need to work within budgetary constraints, of badly maintained buildings, of increasingly unserviceable and outdated equipment. Thus, in my hospital, we still have beds which are up to 50 years old.
Tuppence in the pound per week, because that's what we need to develop and harness and nurture a National Health Service. And I think the most appropriate people to give it to are these nurses here. So on behalf of our campaign, we give you this cheque. Thanks very much. Give them a cheer.
The NHS tries to embody two fine and noble principles. And the first one is this, that healthcare should be equally and freely available to everyone, to every man, woman and child in this country. And the second principle is this, that the burden of providing this service should be borne by the whole community in accordance with the means of its members. Now this second principle, that the community as a whole has a duty to provide for all of its members, that's a principle which I'm proud to say is deeply embedded in Christianity. And in fact, it's the teaching of all the great religious traditions that in the life of the community, it's a duty. No, it's more than a duty, it's a privilege for the rich to provide for the poor and for the wealthy to provide for the disadvantaged. We've been given our resources not to hoard them or keep them for ourselves, but to share them and use them for other people.
Not only have they sold off as the family silver, but they are now beginning and aiming to privatize the National Health Service. Now that is something with which I do not agree. For years we have been underfunded, and last year in England alone we were underfunded by £95 million purely on the pay awards. And the Social Services Committee, which has already been referred to in the House of Commons, have issued their report prior to Lawson's budget in order to impress on the government that any money that there is to spare should go to the NHS and not to reduce taxation. Now I read in the Times this morning a statement by Mrs. Thatcher in response to this report, which asks for another £1 billion next year for the NHS. And her response was that the report was unresearched and they didn't know what they were talking about.
I'm also here to say a thank you, a great thank you on behalf of the parents to everybody who work in those hospitals. Us as parents appreciate you. It's a pity the government doesn't appreciate you and pay you the wages that you deserve. I've got one message which I'd like to carry from this meeting today down to Whitehall and Downing Street. I'd like this message to go to Mr. John Moore, Tony Newton and Edwina Curry. While you sit in your offices in Whitehall and look around you at the £38 million refit that those offices had, you tell us you haven't got enough money for a new children's hospital in Birmingham that's been promised for 20 years. Look around yourselves in Whitehall. Tell them this. Birmingham wants a new children's hospital. We want it now.
We have in our National Health Service one of the most efficient health services in the world. If you compare it, for example, with the American system, a private insurance-based system, which is the government's dream and model, ours is much more efficient.
We're all here to show that it's our health service.
Not Mrs Thatcher's health service, it's our health service. It's a health service for all of us. And the first important message from this rally is one of unity. We don't want two-tier health service. We reject the idea of a health service for the rich and a health service for the poor. We want one health service, the National Health Service. That's the first message to go from today and the first point of this demonstration. But it's also a demonstration which is sending two other messages. And the first of those messages is, as our previous speakers have said, a message to Mrs Thatcher and the Conservative government. We want the money back. They've taken billions from the health service here in the West Midlands. And we won't be set off one against another by the chairman of the Regional Health Authority or anybody else. We're a demonstration of unity, not just in Birmingham, but in the West Midlands as a whole. We won't solve the problems of the Children's Hospital in Birmingham at the expense of the health service in Wolverhampton or Coventry. We want to restore the health service across the West Midlands as a whole. And that will need billions of pounds put back into the health service nationally so that we get here in the West Midlands our fair share. To restore the health service, not to what it was 10 years ago, but just to restore it to what it was before they had a general election that they won on a promise of reducing the waiting lists. And so our first message to Mrs Thatcher is to restore the damage that she's done and then take her hands off our National Health Service. But we're here today also to give another message. A message to all MPs of all parties, not just the Labour Party and the Tory Party, but the other parties as well, whatever they call themselves. In a fortnight's time we shall have a budget which follows statement after statement that they haven't got the money for the health service. A country that's got the money to modernise nuclear weapons has got the money to modernise its health service.